Hi, my name is Blanca, and today I will be demonstrating on how to do five projections of the knee. And before we start off and we get our patient, I have already set up my console to the table bucky, since that's what we're going to be using. Also, I'm going to be detenting my tube to my table bucky. I'm going to detent my tube to the table bucky. Then I'm going to lower down my x-ray tube. And also next I'm going to be inserting my IR into the table bucky. And in this case we're going to be using portrait orientation. Once I have that there, also our SID is going to be at 40 inches. But then yet again, once we have the patient in here, we're probably going to have to readjust our SID again. So once I have that ready to go, I have my shield here ready to go as well. I'm going to go ahead and get my patient. Morales? Yes. Hello, my name is Blanca. I'm a radiography student, and I will be doing the exam for you today.
Okay.
And can I have your full name, please?
Morales.
And your date of birth?
8/20/72.
Okay. And what brings you here today?
I fell like a week ago and I hurt my knee and it's been bothering me since. So.
Okay. And where exactly is the pain?
Like at the bottom of my knee.
Okay. And is there any chance you might be pregnant?
No.
Okay. Cool. So just to make sure that I'm doing the correct exam, is your right correct? Okay, so our patient, she's already in a gown, so next we're going to have her lay down in the table bucky in a supine position. So you could go ahead and follow me.
Okay.
I have put down the table for you, so you could go ahead and lay down and you move this out of here. That way you don't hit yourself or anything like that.
Okay.
And I'm going to shield my patient, which is the most important thing. I'm going to place this on top of you. And then next, I'm going to go ahead and put my table bucky up. That way we protect our backs. Okay, so once we have that there, a little bit higher. That's fine. I'm going to move over my extra tube. And I'm going to readjust my SID due to the fact that I raised the table. So once I have that there, then depending on the ass's measurements, I'm going to angle my tube between 3 to 5 degrees cephalic. So in this situation, I'm going to angle to 5 degrees. I'm sorry, ma'am. So once I have that there, I'm going to make sure that my tube is aligned to my IR, to my table bucky. Okay, we're aligned there. And I'm going to have you, ma'am, if you could go ahead and extend your leg out.
Okay.
That'd be perfect. And I'm going to look for locate the patella. Okay. And I'm going to be moving you a little bit towards me.
Okay.
Actually, let me go around it. There we go. Thank you for being so patient with me. Once we have that there, the central ray is going to enter 1/2 inch inferior to the apex of the patella. So once we found that there, I'm going to collimate. Place my right marker. And if you could stay still.
Okay.
Beep, X-ray. So our technique for our AP knee projection, it was 70 kVp and between 4 to 8 mass. So now I'm going to go ahead and demonstrate my second projection, which is the AP oblique with medial rotation. I'm going to remove my IR, grab a clean one, place it again, portrait orientation. Once we have that there, we're going to flex the knee, flex the leg 45 degrees medially. So I'm going to go ahead and turn your leg inward, 45 degrees. I'm going to roll the leg. Are you okay?
Yes.
So once we have that there, again, my tube angulation for the AP oblique projection when medial rotation, it varies depending on the axis of the patient. So in this situation, I'm going to leave it at the 5 degrees cephalic. And again, I'm going to locate the patella, and my central ray is ½ an inch inferior to the apex of the patella. So we have it there. I'm going to collimate, place my marker, my right marker, and then I just want to double check that I'm aligned, which I am. Once we have that ready to go, please don't move, stay still.
Mm-hmm.
X-ray, beep. And my technique was 70 kVp between 4 to 8 mass. So remove my IR, grab a new one. And ma'am, I'm going to ask you if you could go ahead and get on your right side.
Okay.
Towards me. Let me go ahead and move this one here. And the patient will be on the affected side, and the unaffected leg could either go, it could be in the front or backward, which in this situation she would like to have it. We like to have it in the back.
Yeah, that's
that leg back there. Okay. And we're going to flex the knee between 20 to 30, flexing the knee, and then also tube angulation. For the lateral projection is 5 to 7 degrees cephalic, and in this case I'll be sticking again to 5 degrees cephalic for my tube angulation. And next I'm going to be flexing the knee 20 to 30, the leg, I'm sorry. So once we have that there, I'm going to move my table, and for the center ray, we'll enter 1 inch distal to the medial epicondyle. And just making sure that our epicondyle is, along with our patella, is perpendicular to the IR. Placing our marker. And then shielding our patient. Stay still, don't move. Beep, X-ray. So this projection that I just demonstrated, that was our medial lateral projection of the knee. So, and the technique wise was 70 kVp between 4 to 8 mass, I'm sorry. So once we have that there, we're going to go ahead and continue with our next projections. So now we're going to move forward with our next 2 projections, which they're going to be tabletop. So my console has been set up to tabletop, and right now I will be doing the AP axial projection of the intercondylar fossa, known also as the Beclaire method. Ask my patient if they could go ahead and flex their leg to 60 degrees. So Ms. Morales, if you could go ahead and flex your leg to 60, approximately it will be around to how the leg is about right now. And then after that, I will be placing some sponges and also sandbags to support the IR. So I will be placing them underneath the knee and then also adding a sponge. And we're going to be using, our IR will be in crosswise orientation. So maybe you can go ahead and allow me to put this underneath. So once we have that there, then my center ray is going to be perpendicular to the long axis of the leg. And I'm going to locate my patella, since the center ray has to enter half an inch inferior to the apex of the patella. So once I have that there, I'm just making sure that my SID is approximately 40 inches. So I'm going to come in a little bit closer, that way we could be at the 40 inch. And then I'm just going to collimate in. So once I have that there, then I'm going to place my right marker, and then again making sure that my patient is shielded, which she is. So I'm going to place that there. And technique-wise is going to be 70 kVp at 5 mass. So Ms. Morales, if you could stay still. Beep, X-ray. Okay, so we finished our Beclaire method projection. So now I'm going to move into my last projection, which is the tangential projection of the patella. And the method for this is known as the Setagast method, or also known as sunrise. So for this projection, I'm going to ask my patient to flex their knee as much as possible as they can. So Ms. Morales, if you could flex your knee as much as you can. So once she has that there, we just want to make sure that our knee is going to be perpendicular to our IR. In here, I'm going to be angling my tube, and that it could be between 15 to 20, but it all varies on the flexion of the knee and the leg. So I'm going to lower this down, since we want our IR to be perpendicular to the knee area. Going with no angle, about how I mentioned, 15 degrees. There, I'm going to lower my X-ray tube, and then I will be providing my patient with the IR, which needs to be in portrait orientation. So Ms. Morales, if you could go ahead and hold this here for me. Okay. So once we have that there, then I'm going to locate the patella, since our center ray needs to enter perpendicular to the patellofemoral joint. So once I locate my patella, then I'm going to have it there. Then I'm going to collimate in a little. Checking also my distance, since it has to be 40 degrees. Once I have that there, just making sure. And placing my marker. Alright. And maybe you could go ahead and stay still, Ms. Morales. Okay. Beep, X-ray. And my technique for this was actually, I could go ahead and take that. My technique was 70 kVp at 4 mass. And this concludes all the 5 projections of the knee. Thank you.